I would definitely rather have the AcuDose-Rx than be without it. It's so simple to use, it's simple to teach other people, and it gives me more time to spend with my patients.
Before we implemented AcuDose, there were nursing concerns about the availability of medications. Often we would get called for stat doses that we had to send up to the floor. With the profile dispensing in the AcuDose cabinets, as soon as we put the medication in the system, it's available for the nurse, and that has improved the relationship between pharmacy and nursing. Prior to the implementation of AcuDose, we did card fill and card exchange. What has happened since we implemented AcuDose is that it has streamlined our process. Instead of picking medications for one patient at a time, we're picking medications for the whole nursing unit. The accuracy and detail of AcuDose reports have allowed us to improve our narcotic tracking and increase medication safety and security. AcuDose cabinets have been a good addition here at Clarion Hospital. It has helped us regain lost charges, improve medication safety, and improve our narcotic surveillance.
Here at Sharon Regional, our administration and board of directors are very pleased that we work with McKesson because they are looking at the most innovative ways to help patient safety move forward in the healthcare system. We use the whole McKesson line of products, from the AcuDose, the robot, also the NARC station, and the AdminRx bedside barcode scanning. We're able to integrate everything from the pharmacy perspective and the nursing perspective to know exactly what's happening with our patients. We're fortunate here at Sharon because we have both the AcuDose-Rx cabinet and the NARC station, and they're integrated so that we have better control of our narcotics, and we also have a good handle on the inventory on the floors for the nurses. As a director of pharmacy, I like the AcuDose-Rx reports because they allow me to see what is happening with a time and date. So if we have any discrepancies or any issues that we want to look at further, we're able to see exactly who is in the cabinet and exactly when they were in the cabinet.
Okay, before we had AcuDose, there was a lot of tension between pharmacy and nursing, and then after we got the AcuDose, the relationship was wonderful. You know, they have what they need when they need it, and there's not a lot of phone calls, and everyone's happy. After we brought AcuDose up and we were live with it on the units, the nurses told me that they had a lot of peace of mind that they knew they were given the right dose to the right patients, because the AcuDose screen would tell them exactly which drawer, exactly which pocket, so they knew they had the right med.
Before we put the AcuDose cabinets in, we had a manual system in the critical care units. The nurses would have to go to a drawer, look for whatever kind of medication they were going to need, and we weren't sure that they were always charging for those medications. In addition to that, it was a manual process to get all the meds reordered. So since we put the AcuDose cabinet in, the nurses are very happy because they know exactly where to go to get the medication they need. They know it's going to be there, and then I'm comfortable because I know the charge is getting entered. The AcuDose cabinet really has helped free up our nurses from doing a lot of the manual tracking of medications. So they're able to spend more time with the patients and with the families, perhaps providing teaching about the medications instead of spending their time going to look for that medication. Well, one of the things the AcuDose cabinet has helped us with is the ability to adjust our par levels of medications we have in the units. And as procedures and practices change or different physicians come on, they may not use a medication that a prior physician had used. So instead of us keeping it in the cabinet and that costing us money, that's an asset sitting there that we can return to the pharmacy and update the AcuDose cabinet with what we're really using. If we had to get rid of the AcuDose cabinets, I think the nurses would have a fit crying that what are they going to do, how are they going to manage the medications. I would be concerned that I would have loss of charges, medications not controlled. I mean, there's just so many things that would become undone if we were to lose the AcuDose cabinets.
Before AcuDose, our concerns were with safety issues. Patients were concerned with not getting the right meds. And now that we have AcuDose, it is much safer, patients are more satisfied, and nurses love it.
We became nurses so that we could take care of patients and not be out at the desk. AcuDose allows us to get the medication quickly and give our patients the care they need. Our patients are safer because of the AcuDose system. With the profile dispensing, we're able to give the right drug, the right dose, at the right time to the right patient.